Hello, you're welcome to another edition of my program called Health Talk with Queen Nikki. Today, what's going to be our topic for today is going to be respiratory infection among everybody, not only children, adults, respiratory management, respiratory infection. So we're approaching flu season again and all over the world. You guys can benefit from this, so let's go into the topics. Okay, so now, like I always say during this period of the season, in all my previous videos about taking care of our children, because they are the key vulnerable people when it comes to respiratory infection, even in adult, like grandpa, grandma, so this video is very good for you guys. Number one, make sure your children is immunized, especially during flu season with influenza vaccine. I am not advocating or advertising any vaccination on my program, but like a nurse perspective, we always preach prevention, and that's why I keep mentioning all the due to the nature of where I reside, which is the United States. But I believe that influenza vaccine would, serve a better purpose for the children. That's why I always, emphasize on that. Flu season is approaching. We are now in flu season. Please make sure your children, they are immunized with influenza vaccine to protect them. It's for their own protection. But let's now go back to the basic, which is hand washing. I did a video on my program. If you check the TikTok, YouTube, and Instagram, which I upload the video about importance of hand wash. Now, this is the number one safest and less affordable preventive measure that you can give you or educate your children and the older one. Please encourage them to wash their hands frequently, especially when they go to school. Very important. If you have not watched those videos, at least I did 3 or 4 videos concerning that. The return to school backpack, how to wash their hand, I demonstrated, and so many others. So check my distant video. Very important. That's the only way we can, the safest way we can prevent respiratory infection. Hand washing. They don't have water or soap to wash their hand, alternate is hand sanitizer. Very important. If you have the elder ones at home, you can also put hand sanitizer close to them, or you encourage their caregiver to frequently wash their hand. Very important. Now, for those that their immune system is compromised, like the pregnant women, people that are sick with cancer or any illness, when they are going outside, please mask. They need to wear their mask. Very important. It's for their own protection too. And they need to. This is very important. So wear their masks anywhere they're going for doctor's appointment, or they are going to the store with you. They need to put on their masks. And then the next one is, when you notice that your people that you guys are living together are sick, avoid contact. This is preventive measure that we always encourage people to do, to avoid contact with sick people. If you are sick, especially with nurses, we work with sick patients. When we're sick, we stay at home, right? Like me, for example, I can only use myself. When I'm sick, I make sure that I put on mask in the aisle, wash my hand very well, and isolate myself away from my children. That's the key. I isolate myself so that way I don't cross-contaminate them or give them infection. Respiratory infection spread very well. It spreads faster. And if you have kids or grandpa that their immune system is compromised, you want to isolate yourself away from them. Now, let's say they are the one that is sick, the children or the grandpa, grandma that is immune system is low. you can also isolate them too till their sickness will go away for now, so that's the key thing that we always. And also make sure your children immunization is up to date. Key thing, up to date. Their immunization is up to date. They wash their hands. And education, sit your children down and tell them that, okay, now this is respiratory infection season, where we sneeze and we get in contact with people that are sick. Please do A, B, C, D. Very important. Communication is the key. Communication. Educate them that, okay, watch Queen Nikki video, right? Watch Queen Nikki video and get educated, or other content creators that talked about health on social media and get educated, right? And your kids will be excited, and they'll be well educated. And for grandma, grandpa, that they are still cognitive, alert, you can also show me them my video to tell them to stay away during this respiratory season. Okay. And also another thing, they need to cover themselves when they're sneezing so they don't spread the germ. Cover themselves, make sure they wipe their decks at school, and if they put all this thing in place, they should be good to go. Okay, they should be good to go. Now, for children, little kid that are like between a day old baby to 6 months, especially newborn, when you newly have them and you bring them home, please let them stay away from guests that come to visit them, carry them, kiss them, hug them. They are still little. Their immune system is still trying to get used to the world environment. So tell those your neighbors, your family member that is bringing this little children that's coming to say hi to the newborn, to stay away a little bit when it comes to kissing and hugging them, because they can spread germ through this way to the newborn baby. Okay, they can hold the baby with their mouth or frequently wash their hand before they handle the baby. Very, very important. This is one thing parents don't do, and at the end of the day, the child will become sick, and then they'll be running around with this little newborn. Okay, so very, very important to put at the back of the parent and the caregiver mind. Okay, and I think that's about it. Once we put all these things, we should be good to go. Now, what are the signs that we need to watch out if it's influenza or just coughing, especially for kids who have asthma? I already talked about asthma in my video. Check it out too. Okay, now coughing can be dry or productive cough. Sneezing, it can be productive or not productive. Fever in some cases, runny nose, headache, shivering, heart, different. It depends on individual's body. Okay, but the key thing with children, because they can't verbalize if they're sick, especially less than 1 year old, is the number one thing that is always running nose and fever, running nose and fever. Even though COVID is still manageable now, but it's still in vogue. And for influenza, we have different strain every year, so this year might be stronger than the one next year. That's why we need to keep taking this vaccination. So if you see your child exhibiting any of this symptom, take that person to the primary care doctor or the direct doctor that is taking care of that child to get that child checked out before it becomes really, really serious. Now, for children, if it's getting to the time that they can't breathe, they are breathing very, very fast, using all their muscle to breathe, they can have subcostal retraction, intercostal retraction, nasal flaring, colored chin, dry mouth. Take it serious. Sometimes they can be dehydrated with it because they will have decreased PO intake, decreased urine output. Make sure you put all this in place and take them to the primary care doctor, so that way they can get it checked out. I think with this we're good to go. Till I see you guys in my next episode, remain blessed and take care of yourself, and God bless.